In Los Angeles, to surgically repair your broken arm, you're gonna get a hospital bill total of about $38,390. If you have work insurance like most Americans, you're gonna pay a specific portion of that total cost. But in Spain, the same surgical repair costs $0, literally $0. On paper, you'd want Spanish healthcare over US healthcare every single day of the week. So why are Spaniards rushing out to buy private insurance if they have universal healthcare? That's what this video will explore. It'll compare healthcare costs in Spain and the US, pros and cons of each system, and investigate whether free healthcare is really all it's cracked up to be. Let's dive in. So let's talk about the basics before we get into the money and the strange trend that's happening in Spain. The US has the world's most complex system, without a doubt. A combo of Bismarck, beverage, national health insurance, and out-of-pocket. But we'll focus on the Bismarck system in this video because 167 million Americans get access to healthcare through their job. Spain uses a beverage system where healthcare is paid for entirely by taxes, and it's run by the central government and their 17 autonomous communities, which are a lot like our 50 states. In the US, your boss or the finance team is often going to choose your medical plans, where you can go to see a doctor and how much you pay for medications. Cost-wise, most US companies pay between 70 and 100% of the employees' monthly costs or their premiums. But remember, that's not the cost to see a doctor. That's just the cost to access the system's discounted rates. And speaking generally here, if your job is not considered highly specialized, like maybe a barista, for example, you most likely aren't going to get the best medical plan. In Spain, on the other hand, whether you're an engineer or a barista, your baseline healthcare is legally locked in. You get the same level of benefits as everybody else in the country, even if you were to decide to quit your job. Healthcare is universal, meaning just about everybody gets access to it. Now, cost-wise in Spain, you typically pay nothing. You just show your public health card and you get care. A doctor's appointment is $0, specialist visit, emergency room, surgeries, hospital stay, all $0. Now, I know I mentioned that 38K broken arm surgery in the United States. Now, in Spain, if you get that broken arm surgery, you're gonna walk out with the same amount of money that you had before. But here's how the cost would break down in the United States with work insurance. So the total hospital bill would be 38K, but that's before your insurance kicks in. So we'll say our US worker has a standard medical plan that they pay $125 a month just to have. The patient ends up owing $5,000 even though they pay monthly for their insurance. And I personally think the bigger problem here is that the broken arm surgery might be $38,000 for one patient, $15,000 for another patient, and maybe $53,000 for a different patient, all at the exact same hospital. And this is based purely off the negotiations between insurance companies and hospitals. A topic for another video, but this is why nobody pays the same price in the US for healthcare. Obviously, this frustrates a lot of Americans, and it really perplexes those from other countries. But before we get into all that, nothing can be really free in this world, right? I mean, a broken arm surgery can't really be $0 in Spain. Well, they do pay for their taxes. The age-old debate is which is really cheaper, the system where you pay less taxes but higher healthcare costs, or the system where you pay for taxes but nothing on healthcare. I was personally curious, so I ran some rough numbers. So let's say there's 3 people. There's one in California, one in Texas, and one in Spain, and they all make $50,000 US a year. Here's what they would keep after taxes. Ignoring differences in cost of living, it is cheaper to live in Spain. This means that you're gonna pay pretty high taxes in Spain. I mean, I live in California, I think taxes are excessive here, but this is a whole nother level. But getting back to the question, the average American spends $1,600 a year on healthcare out of their own pocket. So you still keep more money living in Texas and California than in Spain. But remember, if your company doesn't pay for all of your insurance, you need to take that into account as well. That brings the final totals pretty close to one another for these 3 people. Now, if you had some emergency or that broken arm surgery, you'd probably wish that you got the Spanish bill. But that brings us back to the mystery that we mentioned at the beginning of this video. They have a public system that covers their doctor visits, surgeries, ER visits for literally $0, and most importantly, you can go as much as you want. But despite this, millions of Spaniards are buying private health insurance. Why? The short answer is speed. If you have a true emergency like a heart attack, a stroke, or a severe accident, the Spanish public healthcare system performs really well. You don't wait that long for emergencies, just like in the US for most cases, and you leave with your $0 bill. But where their system breaks down is non-emergency care. If you need to see a specialist for something that isn't immediately life-threatening, you first go through a referral process that's similar to some medical plans in the United States. But according to the latest national data, the average wait time for the first specialist consultation is between 87 and 105 days. But remember, in Spain, this is just for the first appointment. If you need non-emergency surgery, you enter another waiting list. The same national reporting shows average surgical wait times of around 112 to 126 days, with hundreds of thousands of people, roughly 846,000 to 850,000 patients at any given time, waiting for a procedure. And for those affected by these wait times, the only way to get around them is to buy private insurance. So roughly 1 in 4 Spaniards now have private insurance, and those numbers are growing each year. For major illnesses, complex surgery, the public system remains the default, but for routine specialist visits and elective procedures, many use their private plans to reduce their waits. And in large cities like Madrid or Barcelona, these private appointments can often be got in days instead of months to years. So you end up with a dual system, one that guarantees access to healthcare regardless of income, and another that allows you to reduce your wait times for $60 to $80 a month. So Spain's free healthcare really better? Which trade-off makes more sense depends entirely on what kind of risk you're willing to deal with and how good your insurance plan is in the US. And we didn't even get into drug cost differences. We'll save that for a future video. If you found this video interesting, you'd like to see more like it in the future, please consider subscribing for more. This is Tyler Dutchover. Thanks for watching.